You know, Sharon, we're in a very special location that says a lot about this uniqueness of the Israeli Faculty of Medicine. When the faculty was being built, in record time, by the way, of course, there was an excavation, which we're in now, and unknown to anyone, an ancient water cistern was revealed as part of the excavation, which really shows the connection of this faculty in Tzfat between the past and the future in medicine and in all aspects. And it's so aesthetically pleasing and beautiful.
It is. So, my name is Dr. Sharon Goldman. I'm Vice President Bar Ilan, and I'm here with Professor Dr. Karl Skwaretsky, the Dean of the Azrieli Faculty of Medicine here in Tzfat in the Galilee. So let's talk about the Azrieli Faculty of Medicine for a moment. We know it's understood, the research is top level, and we've got some experts in particular fields. The teaching methods are state of the art, but what makes this place different and unique from some of the other great educational institutions in Israel?
I feel this is like a second aliyah for me to a very, very special, unique opportunity in medical education and medical research. So this is the 10th year, we're entering the 10th year of the Azrieli Faculty of Medicine here in the Galilee, and it's now a well-established Faculty of Medicine equal to all others in terms of the conventional research and education and graduates, more than 450 graduates already, and a class, more than 450 students now studying, so it's really well established. But there's something very extra special about, one, the fact that this is a Faculty of Medicine with a high level of what's called social accountability. That is to say, the faculty was established in order to bring up the level of health care in the Galilee. 1.5 million people in northern Israel whose level of health care is really been brought up to a great extent thanks to the Faculty of Medicine, and the connection with the medical centers throughout the Galilee, with the ambulatory centers throughout the Galilee is unique. It's different than anywhere else in the country. And we're thinking not of the education of the past, but we're trying to educate the physician of the future. And that means the ability to render and provide and the skill sets needed for a student to be a physician of tomorrow, to be able to both interact face-to-face with a patient, but also using modern tools of telemedicine, for example, which is very, very important in the Galilee because our patient population is spread out throughout the Galilee. So we have to have physicians who are able to converge human intelligence with artificial intelligence. We have just wonderfully devoted faculty members who have come here because they're mission-driven. Very similar to what Linda, my wife, and I have done. We've come here, because we see a mission that's a further fulfillment of our Zionist ideal and
building the Galilee.
Exactly.
Of really building the Galilee, which is unique and special. Speaking of technology, though, I thought maybe we'd go look at some of the things that we have special and unique here at Bar Ilan that nowhere else in Israel has.
So there are many. For example, anatomy has been taught about the same way for several hundred years. And we said, no, maybe there's better ways to teach anatomy more accurately, more effectively, take advantage and leverage modern technologies. And we have the only Anatomage, a virtual anatomy technology teaching tool in the whole country, which I think is just fantastic.
So let's go see it.
Yeah, let's see it. Dr. Yair Bloomberg. Hi, I'd like you to meet Dr. Sharon Goldman, who's the Vice President for Development of Bar Ilan University. Now, I told her all about your research and your very special teaching methods in physiology, and I mentioned anatomy, that we have the only virtual anatomy teaching capability in the entire country. I wonder if you could explain it to us, please.
Yes, of course. Turn off the light, please. So here we have a cavada, or actually a real cavada, which was scanned previously. And here we could teach the students a lot of positions that they cannot see in a real dissection. For instance, we could take the whole body layers, and they could see layer by layer. And a very interesting thing that we could see, we could also see the movement of, for instance, of the blood, or the way the blood flows. And here we have the draining of the blood from the leg towards the heart.
So there's no way they could see this in a real dissection.
Never, never, and this is something that it's very valuable and very important for a physician to learn how the blood drains towards the heart.
Yeah, Ira, since you mentioned the heart, can we actually see the heart and what it looks like inside here?
Yes, definitely. Here we have the heart,
Wow.
a real picture of the heart, and actually the students could actually...
Is this that patient's heart?
This is a patient's heart, and here we could actually have another interesting feature that we could actually go through the heart, into the heart, and have a virtual tour in the heart itself.
Thank you very much.
The anatomy table was amazing. Clearly, you guys are doing tremendous things in terms of teaching, but I know that COVID-19 has also created some interesting opportunities for you to engage with the population of the Galil in ways that are important to all of you.
So, we're all about converging technology with people and population health. So that's why it's really important for, I think, to meet someone like Dr. Sivan Spitzer-Shochad, who's the head of our population health education. So that's what our next stop is.
Sounds great.
Well, Sharon, we're in the medical library of the Israeli Faculty of Medicine, as you know. And with us, we have Dr. Sivan Spitzer-Shochad, who is the head of population health education for the faculty. And Sivan, of course, the experience of COVID-19 has been very, very traumatic and very difficult for the world as a whole and for us. But we've learned something very special through this program about our medical students and about our medical education. Can you tell us a little bit about that?
Sure. So I think the pandemic actually presented us with a unique educational opportunity for our students. What we did, we first really went out to our partners in the community, to the healthcare services out in the Galil, to different municipalities to really ask what are the challenges they were facing during the pandemic. And we understood that one of the major challenges was the backlog of treating chronic care patients. And so within 2 weeks, we set up a platform where we sent out over 80 students to 60 clinics across the entire Galil to really help out teams take care of these patients, these chronic care patients who are at home, afraid to come to clinic, and weren't getting treated because of COVID-19. It really presented a wonderful educational opportunity for our students to get to know the Galil communities, to understand what are the challenges, and I think it really opened our students' eyes to the practice in these clinics.
But it's actually part of a bigger experience that you've been leading with respect to our medical students, social accountability in the community. Can you tell us about that?
So I think this faculty was really set up with a unique mission of being accountable to the Galil and to the surrounding community. And so we have a spiral curriculum of population health and health determinants, social determinants of health, to really get our students out in the community to understand challenges of health literacy, of health disparities, of health inequities. And we have programs like the EDGAR program, where students really help patients transition from hospital back home, address really the issues of many patients across the Galil.
Thank you very much, Sivan. Thank you, Sharon.
I really want to thank you for your time here today. It's been amazing seeing your faculty. I wonder though, before I leave, if it would be possible for me to talk to one of your students.
Well, Sharon, first of all, thank you so much for coming. And it turns out that's what we're all about. So I've actually arranged for one of the students to meet with you.
Amazing, amazing. Thank you so much again for your time. And
Wonderful.
we will talk again soon.
Okay, we'll see you soon.
Hi.
Hi,
Nice to see you.
nice to see you too.
I'm Sharon Goldman. I'm Vice President at Bar Ilan, and you are
Lee.
Leah Azulay, right?
Yes.
The head of the Student Association here at the Faculty of Medicine.
Yes, exactly.
What brought you specifically to this particular Faculty of Medicine here in Tzfat?
I lived in Europe for almost 7 years, and I decided I want to come back to Israel. And the only place that opened their door to people from abroad to come back here, it's Tzfat, this faculty.
There is something special about this place, and it really is part of the whole Zionist mission here, is to bring back our best and our brightest. We were talking beforehand a little bit about what the Student Association did during the time of COVID-19.
So last year, or in around March, we as a student association start to work with MADA,
Magen David Adom.
Magen David Adom, and we open many areas that called drive-in. Those drive-in help us to do some screening and diagnostics tests for the corona for all the population in the north. So this was a volunteering program. We I think 75% of our students came to volunteer in all those drive-in, from the morning till the evening, every day, for 2 months almost. And I think that this gives let's say we drive all the process of screening and checking of the corona in the north.
It's amazing. So just to finish up here, I have to ask, when you finish your studies, are you coming back? Are you going to live here? Are you going to practice medicine in the Galil?
Definitely.
Thank you for your time.
Thank you.
Got a glimpse into just some of the amazing things that are happening here at the Azrieli Faculty of Medicine at Bar Ilan. You got to hear from the Dean of the Faculty, a few of our incredible researchers, and even the head of our Student Association. I want to invite each and every one of you, though, to come here and see for yourself how this incredible place is transforming the face of the North.